If you're watching this video, it's probably because, like me, you face mobility challenges you never imagined you'd have. My name is Dr. Thomas Anderson. I'm 72 years old, and for 40 years I practiced medicine as an orthopedic surgeon. I want to share with you a discovery that completely transformed my life, and it can transform yours as well. Perhaps you identify with my story. Until I was 68, I considered myself an active man, just as you probably did before your problems began. You know how it is. One morning you wake up and something is different. Your body no longer responds the way it always has. That's exactly what happened to me on a September morning. When I tried to get out of bed, I felt a strange stiffness in my right hip. You know that feeling, don't you? It's not exactly pain, but a deep discomfort that makes you hesitate before putting your foot on the floor. As a doctor, my first reaction was to rationalize it. I probably slept in a bad position, I thought. You likely did the same when your issues began, trying to find a simple explanation, a way to downplay what was happening. I managed to finish my morning routine, but my wife, Dorothy, noticed I was walking differently. Has your family noticed changes in you? It's always like that. The people around us are the first to realize when something isn't right. "Tom, are you okay?" she asked, wearing that worried expression you probably recognize on your loved ones' faces. "Just a little stiff today," I answered, trying to sound casual. "Did you also try to minimize your symptoms at first? It's natural to want to shield those we love from worry." Over the next few days, I watched my condition gradually worsen. The stiffness in my hip intensified. I began to develop a compensatory way of walking, something you might be experiencing now. Your body is smart and tries to adapt, but these adaptations sometimes create new problems. Ironically, as a physician, I fully understood what was happening in my body. Yet you don't need to be a doctor to sense that something important is changing in your life, and you probably feel the same. 2 weeks later, Dorothy insisted that I see a colleague. "Tom, you may be a doctor, but you need an outside pair of eyes," she said. "Sometimes we need others to push us to do what we know is right." Reluctantly, I scheduled an appointment with Dr. James Mitchell, an orthopedic surgeon I had mentored. The irony was clear. Becoming the patient after always being the one in control. During the exam, I already knew what the X-rays would reveal. Our bodies send clear signals even before we have an official diagnosis. "Dr. Anderson," James said, "you're developing degenerative arthritis in your hip. It's a natural part of aging. Degenerative arthritis. Maybe you've heard those words too, or other terms like osteoarthritis, joint wear, or simply arthrosis. The result is the same, the confirmation that your mobility is being compromised by something that only tends to worsen over time. "What are our options?" I asked, trying to maintain my professional composure. James laid out the standard protocol. Anti-inflammatories, physical therapy, adjustments to physical activity, and, in advanced cases, hip replacement surgery. You've probably received similar recommendations. These treatments can help, but perhaps you felt, as I did, that there was something limited about those options. I left the office with familiar prescriptions and a referral for physical therapy. But I also carried something I had never experienced before. The patient's perspective, the sensation that my own body was betraying me. In the months that followed, I rigorously followed the treatment protocol. I took the anti-inflammatories, which eased the pain but upset my stomach. I attended physical therapy 3 times a week, exercises that I now performed with a completely new understanding of their difficulty. Dorothy began making small adaptations at home. She installed grab bars in the bathroom and bought special cushions for the chairs. Each change, though helpful, reminded me of my progressive loss of mobility. My life, which once included long walks and spontaneous trips, was shrinking. The world I had known was becoming smaller each day because this condition makes us avoid activities we once did naturally. Yet it was precisely at my moment of greatest frustration that something unexpected happened, an astonishingly simple discovery that, within just a few days, began to reverse years of limitation. What I learned completely changed my understanding of mobility problems, and it can revolutionize your life too. 3 months had passed since my diagnosis. I followed the medical protocol religiously. Physical therapy, medication, light walks. My condition was stable, but far from improving. Dorothy and I had resigned ourselves to this new reality. Then, on an ordinary afternoon, everything changed. I was in my office organizing some old medical files when I came across a forgotten folder. Inside were notes from a 2019 conference on integrative medicine I'd attended. One lecture had caught my attention at the time: peripheral neural mobilization for hip dysfunctions. The speaker was Dr. Elena Rodriguez, a Spanish physical therapist who was showing impressive results with a simple technique. I remember jotting down, 5-minute technique once a day. Patients report improvement in 48 and 72 hours. Back then, like many traditional doctors, I was skeptical. It sounded too simple to be effective, but now, sitting there with hip pain, I decided to review my notes. Dr. Rodriguez explained that many hip mobility problems weren't just articular, but neural as well. The nerves that control the hip muscles often become trapped or irritated, causing stiffness and pain. Her technique was surprisingly simple. It didn't require expensive equipment, medications, or invasive procedures. It was just a specific sequence of gentle movements that helped free those compromised nerves. I searched for Dr. Rodriguez online and found several published studies on her method. The results were consistent. Patients with hip arthritis, morning stiffness, and chronic pain reported significant improvements within days. I decided to contact her. To my surprise, she replied the same day. During our video call, I explained my situation. She was kind but direct. Dr. Anderson, in many cases of hip arthritis, the problem isn't just joint wear. The surrounding nerves become inflamed and create a cycle of muscle tension. When we release that tension, the body can begin to heal naturally. She taught me the technique during our call. It was only 5 simple movements, each held for 1 minute. The first was a gentle stretch of the front of the hip. The second involved a controlled leg rotation. The other 3 were variations targeting different muscle groups. Do this once a day, she instructed. In the morning, right after you wake up. Be consistent for a week. Initially, I hesitated. As a doctor, I was used to more complex treatments, but the pain and limitation motivated me to try. After all, what did I have to lose? During the first session, the movements were uncomfortable. My hip was stiff, and I felt resistance. But there was no sharp pain, just the sensation of tight muscles being gently stretched. That evening, I noticed something different. When I stood up from my chair to go to dinner, the movement was slightly easier. Dorothy noticed too. "You're walking differently today," she remarked at dinner. I didn't want to create false expectations, so I just smiled. But inside, I was curious. Could something so simple make a difference? On the second day, I repeated the sequence. The movements already felt more natural. My hip wasn't as stiff in the morning. I managed to get out of bed without that usual hesitation. On the third day, something happened that completely surprised me. I was in the garden when I dropped a tool. Instinctively, I squatted down to pick it up. Only afterward did I realize I had done the movement without pain or discomfort. It had been months since I could squat naturally. Dorothy was watering the nearby plants and saw everything. "Tom, you just squatted normally," she said, her eyes wide. In that moment, I realized something fundamental was changing. It wasn't just the pain decreasing, it was my mobility returning in a way I hadn't expected. Dr. Rodriguez's simple technique was working in a way that years of conventional treatment hadn't achieved. This discovery would change not only my own recovery, but my entire understanding of what truly works for mobility problems in our senior years. 1 week after discovering Dr. Rodriguez's technique, I decided to document exactly what I was doing. As a physician, I have always believed in the importance of precise records. But this time, I wasn't documenting for a patient. I was documenting my own transformation. The technique consisted of 5 simple movements, each focused on a specific area of the hip and the surrounding nerves. Dr. Rodriguez had explained that these nerves, when compressed or irritated, caused most of the stiffness and pain we experience. Think of the nerves as electrical wires, she had said during our conversation. When they're pinched or twisted, the message doesn't reach the muscles correctly. The result is tension, pain, and loss of movement. The first movement was what she called the flexor release. Lying on the bed, I brought one knee toward my chest while the other leg remained extended. I held it for 1 minute, then switched legs. At first, I felt strong tension in the front of the hip, but gradually that tension turned into a feeling of relief. The second movement worked on rotation. Sitting on the edge of the bed, I crossed one ankle over the opposite knee and gently pressed the crossed knee downward. This movement released the lateral part of the hip, where I felt the greatest stiffness. The third was a stretch for the posterior area. Standing, I placed one leg on a low chair and leaned gently forward. I felt a deep stretch in the back of the thigh and hip. The fourth movement was the most interesting. Dr. Rodriguez called it the neural slide. Lying down, I slid one leg to the side and then brought it back, as if making a snow angel. The movement was slow and controlled, and I could feel something shifting deep in the hip. The fifth and final movement worked on extension. Lying face down, I raised one leg a few inches off the floor and held it for 1 minute. It strengthened the back muscles and released the front of the hip simultaneously. The fifth and final movement worked on extension. Sitting on the edge of the bed, I lifted one leg a few inches off the floor and held it for 1 minute. It strengthened the back muscles and released the front of the hip simultaneously. On the 4th day of practicing the sequence, something remarkable happened. Dorothy and I were watching television when she mentioned she had forgotten to get the mail. Automatically, I stood up from the armchair to fetch it. Only when I was returning from the mailbox did I realize that I had walked normally for the first time in months. There was no compensatory movement I had developed, nor the morning stiffness that lingered all day. Dorothy noticed immediately. "Tom, you're walking like before," she said, with a mix of surprise and joy on her face. That night, I decided to perform a more challenging test. I went out to the garden and tried to squat to examine my roses. To my surprise, the movement was fluid and painless. I stayed squatting for a few minutes, something I hadn't done in more than 6 months. On the 5th day, the change was undeniable. My morning walk, which had become a painful and limited activity, was pleasurable again. I managed to walk for 20 minutes without significant discomfort. On the 6th day, I cancelled my physical therapy session, not because I disrespected the therapist's work, but because I felt I had found something that worked better for me. On the 7th day, I called Dr. Rodriguez to report my progress. She did not seem surprised. "Dr. Anderson, what you experienced is typical when we manage to release neural restrictions," she explained. "Your body has always had the ability to move well. We just needed to remove the obstacles that were preventing that natural mobility." Determined to understand better what was happening, I began researching neural mobilization more deeply. I discovered that this field of physical therapy had advanced significantly in recent years, but many traditional physicians were still unfamiliar with the techniques. The concept was fascinating. Instead of focusing solely on the hip joint, the neural approach treated the entire nervous system of the region. When the nerves functioned properly, the muscles relaxed, circulation improved, and pain naturally diminished. 2 weeks after starting the technique, I scheduled an appointment with Dr. Mitchell to show him my progress. He was visibly surprised by my improved mobility. "Dr. Anderson, you're clearly better," he admitted. "What changed in your treatment?" I explained the neural mobilization technique. At first, he showed the skepticism I had felt myself, but the results were evident. "Would it be possible for you to teach me this technique?" he asked. "I have other patients who could benefit." I realized at that moment that my discovery wasn't just personal. It was something that could help many other people facing similar problems. The technique had not only restored my mobility, but also gave me something I thought I had lost forever: the hope that improvement was possible, even in situations that seemed permanent. But my journey was only beginning. What I discovered in the months that followed about how our bodies really work would forever change my view of aging and mobility. 3 weeks after starting Dr. Rodriguez's technique, I was completely fascinated by the results. My mobility had improved beyond even my most optimistic expectations, but as a physician, I needed to understand why. I plunged into a deep study of neural mobilization, and what I discovered revolutionized my understanding of pain and mobility in later life. The peripheral nervous system, which includes every nerve outside the brain and spinal cord, is like a complex electrical grid. These nerves don't just transmit signals, they must also glide and move freely through surrounding tissues. When they become stuck or compressed, they create problems that go far beyond simple pain. During our conversation, Dr. Rodriguez had said something crucial. "Arthritis is real, Dr. Anderson, but it's often not the primary cause of your limitation." That statement intrigued me. How could arthritis not be the main culprit? I began reviewing studies on neural tension and found something surprising. In many cases of hip pain, especially in people over 60, the trouble isn't just the worn joint, it's how the surrounding nerves react to that wear. When a joint develops arthritis, the body instinctively tries to protect it. The nearby muscles contract, creating a protective guard. Over time, this constant contraction compresses the nerves, setting up a vicious cycle of tension and pain, like being trapped in permanent defense mode even after protection is no longer necessary. Dr. Rodriguez's technique broke that cycle. Each specific movement released a different zone of neural compression, triggering a cascade of benefits. Muscles relaxed, circulation improved, inflammation declined. 1 month after beginning the practice, I scheduled a new hip X-ray to compare with my previous images. To my surprise, the arthritis was still there. The cartilage wear hadn't magically vanished, yet my pain had dropped by 80%, and my mobility was virtually normal. That confirmed what I was learning. The problem wasn't purely structural, it was functional. During this period, colleagues began calling. Dr. Mitchell had shared my story, and other orthopedists wanted details. One day, Dr. Sarah Chen, a rheumatologist I greatly respect, phoned me. "Tom, James told me about your recovery. I have a 69-year-old patient with a similar issue. She's tried everything, medications, injections, conventional PT, and nothing worked. Could you teach her your technique?" I agreed to meet the patient, Margaret Williams. She arrived at my office using a cane, clearly limited by hip pain. "Dr. Anderson," she said, "Dr. Chen told me you found something that might help. I'm willing to try anything." Margaret reminded me of myself 3 months earlier. The frustration, the fear of losing independence, the gradual concession to a restricted life. I taught her the 5 movements, explaining each one carefully. Like me at first, she was skeptical. "Doctor, this looks far too simple," she said. "I thought the same," I replied, "but sometimes the simplest solutions are the most effective." A week later, Margaret called me. Her voice sounded different, brighter, more hopeful. "Dr. Anderson, I don't know how this is possible, but I'm walking better. Yesterday I climbed my stairs without using the handrail." 2 weeks after that, she returned to my office walking without her cane. "Doctor, my life is back," she said, tears in her eyes. I can visit my grandchildren again. I can shop for myself. I feel I've regained my independence. Margaret's case wasn't unique. Over the following weeks, I taught the technique to more than a dozen people, and the results were consistently positive, yet every case was different. Some improved quickly, like Margaret and me. Others needed more time. A few required modifications to accommodate other limitations. That taught me an important lesson. The technique is powerful, but it must be adapted to each individual. It's not a one-size-fits-all solution. It's a principle that can be personalized. I also learned consistency is crucial. People who practiced daily saw dramatic results. Those who did it sporadically experienced smaller gains. Dr. Rodriguez had said something that now made perfect sense. The nervous system responds to consistent repetition. It's like learning a new language. Regular practice creates lasting change. 6 weeks after my discovery, I was no longer merely a recovered patient. I had become an advocate for this approach. But I also knew there was still much to learn about maximizing results and helping people with varied limitations. The journey was far from over. In fact, the best was yet to come. 2 months after my own recovery, I had already taught the technique to more than 20 people. Each case taught me something new about adapting the movements to different limitations and needs. Robert Chen, 74, stepped into my office with a different problem. Besides hip arthritis, he had undergone knee surgery years earlier, and the standard movements were uncomfortable for him. Dr. Anderson, I've tried to do the exercises the way you showed, but my knee won't allow it, he explained, visibly frustrated. That made me realize something important. The technique had to be flexible. I worked with Robert to modify each movement, respecting his limitations. For the first movement, instead of pulling his knee to his chest while lying on the bed, he did the same stretch, sitting in a chair, gently lifting his thigh. For the second movement, where we cross one ankle over the opposite knee, he rested his operated foot on a low cushion, reducing the strain on his knee during the stretch. The most interesting discovery was that the modifications didn't reduce the technique's effectiveness. Robert achieved excellent results even with the adjustments. Doctor, I never imagined something so simple could help me this much, he said after 2 weeks. I can walk without pain for the first time in years. Robert's case led me to develop what I began calling the adaptive protocol. For people with specific limitations, we created modified versions that preserved the principle of neural release while honoring individual capacities. Mary Patterson, 71, presented another challenge. She was afraid of falling and felt unsafe doing any standing movements. For her, I designed a version entirely based on seated and supine positions. I can do everything in my bed or armchair, she said, relieved. That gives me the confidence to practice every day. Mary also achieved great results. Her confidence grew along with her mobility, and eventually she started attempting some standing movements on her own. During that period, Dorothy made an important observation. Tom, you're helping people in a way you never did in 40 years of conventional medicine. She was right. In traditional medicine, I prescribed treatments. Now I was teaching people to help themselves. The difference was profound. I began noticing interesting patterns. People who practiced in the morning reported more energy throughout the day. Those who did the movements before bed slept better. Some combined both times and saw even better results. I also discovered that small individual variations mattered. Some needed to hold each position longer. Others benefited from slower movements. Everybody responded slightly differently. Dr. Rodriguez had mentioned this in our conversations. The technique is like a base recipe. Each person can season it to taste and need. One of the most touching cases was that of Elena Vasquez, 66. She had stopped dancing, her lifelong passion, because of hip pain. Dr. Dancing has always been my joy, she told me through tears. Losing it felt like losing part of myself. We adapted the technique together, incorporating movements that resembled dance steps. Elena not only regained her mobility, but returned to dance classes 6 weeks later. "Dr. Anderson, you gave me back my soul," she said when she came to thank me. Cases like Elena's made me realize we weren't just restoring physical mobility, we were restoring identities, returning passions, reviving dreams people had abandoned. Dr. Mitchell began referring patients to me regularly. Other colleagues did the same. My informal mobility clinic was outperforming many conventional treatments, but I also learned about limitations. Not everyone responded the same way. People with serious neurological issues or severe structural damage saw smaller improvements. The technique is powerful, but not miraculous. That taught me humility and the importance of realistic expectations. For each person, I explained what was possible and what wasn't, based on their specific condition. One aspect that surprised me was how the technique affected people's confidence. When someone regains mobility they thought was lost forever, their attitude toward aging changes completely. "Doctor, if my hip can improve, maybe other things can too," commented George Williams, 69. He was right. Many patients started eating better, re-engaged in social activities, and even took up new hobbies. The technique was creating a positive ripple effect in people's lives. 3 months after my discovery, I had documented more than 30 success stories, but I knew it was time for the next step. I needed to share this discovery more broadly. What began as my personal search for relief had become something much larger. It was time to think about reaching people beyond my immediate circle. If you've watched this video all the way to this point, it's probably because you see your own situation in my story. Perhaps you also wake up each morning with that familiar stiffness in your hip, or maybe you avoid activities you once did naturally, like squatting to pick something up from the floor, or walking distances that used to feel easy. 4 months after my recovery, I realized I had to share this discovery with more people. I knew thousands of people like you were suffering needlessly, believing that loss of mobility was simply a natural part of aging. When I appeared on a local television program, the response was overwhelming. In the first few hours after the broadcast, I received more than 50 calls. People were crying on the phone, saying things like, "Doctor, that's exactly how I feel," or "Finally, someone understands what I'm going through." You may feel the same way. Perhaps you've tried conventional physical therapy with little success. Or maybe you take medications that help temporarily but leave your stomach irritated. Possibly you've cancelled plans because getting there seemed too challenging. In the weeks following the program, I organized small groups in my home. It was incredible to watch people who arrived walking slowly, some with canes, and within a few weeks were moving with a freedom they hadn't felt in years. If you wake up with hip pain that takes time to warm up, if you avoid stairs because you know they'll be uncomfortable, or if you feel your world growing smaller because it's hard to leave the house, you need to know this doesn't have to be permanent. You may have given up activities you loved. Perhaps you stopped dancing, walking in the park, or getting down on the floor to play with your grandchildren. The technique I discovered can return these joys to you. If you feel unsteady when walking, if you plan every movement to avoid pain, or if you feel you've lost your independence, know that there is real hope. 1 month after the television appearance, I created a simple guide so people like you could learn the technique at home. I wanted something anyone could follow at their own pace without traveling or feeling self-conscious. The guide included clear photos of each movement and straightforward explanations. Most important, it included modifications for different limitations. If you have knee problems or arthritis in other joints, if you're afraid of falling, or if you have trouble getting up from the floor, there are adaptations that work. If you've lost your independence, if you rely on others for tasks you once did by yourself, or if you feel you've become a burden to your family, this technique can change that. Maybe you have an abandoned garden, forgotten hobbies, or dreams you set aside. The mobility you regain can reopen doors you thought were closed forever. If you feel you've lost your zest for life, if every day is a battle against pain and limitation, or if you simply want to feel like yourself again, this discovery was made for you. The most important thing I've learned is that you don't have to accept loss of mobility as inevitable. You don't have to resign yourself to a limited life. You don't have to believe that it's just how things are after 60. In the past few months, I've directly taught this technique to more than 200 people. Each of them had a story like yours and mine, and each discovered that it was possible to regain far more than they ever imagined. If you're watching this video feeling pain, stiffness, or limitation, know this: your recovery story can start today. The 5 simple movements that changed my life are within your reach. We've reached the end of my story, but the beginning of yours can start right now. Before we wrap up, shall we quickly review the 5 movements that can transform your mobility? The technique that changed my life consists of 5 simple movements practiced once a day, preferably in the morning. Each move takes 1 minute, so you need only 5 minutes total. The first movement releases tension at the front of the hip. Lying in bed, pull one knee toward your chest while the other leg stays extended. Hold for 1 minute, then switch legs. Feel the gentle stretch along the front of your hip. The second movement works on rotation. Sitting on the edge of the bed, cross one ankle over the opposite knee and gently press the crossed knee downward. This releases the side of the hip where many people feel stiffness. The third stretch targets the back of the hip. Standing, place one leg on a low chair and lean forward slightly. If standing isn't safe for you, do it seated by simply extending one leg in front of you. The fourth movement is the most important, the neural slide. Lying down, slide one leg out to the side and bring it back as if you were making a snow angel. This movement frees the deep tension that is often the real cause of limitation. The fifth movement strengthens and releases at the same time. Sitting on the edge of the bed, lift one leg a few inches off the floor and hold for 1 minute. This safely works hip extension. Consistency is the key to success. Do these movements every day, ideally at the same time. Your body will respond to regular repetition, creating lasting change. Remember, if anything causes sharp pain, stop immediately. The movement should feel comfortable, producing only a gentle stretch. If you have specific limitations, adapt the movements as needed. During the first few days, you might feel only small changes. Don't get discouraged. By the 3rd or 4th day, many people begin to notice less morning stiffness. Within the first week, most report significant improvements in mobility. The most important thing to understand is that you don't have to accept loss of mobility as inevitable. Your body has an amazing capacity to adapt and improve, even after 60. This technique is not miraculous, but it is powerful when applied consistently. Based on the science of neural mobilization, it addresses the true cause of many mobility problems in our later years. Today, at 72, I walk, garden, and travel with a freedom I hadn't felt in years. Dorothy and I are back to enjoying long walks together. I've regained not only my mobility, but also my confidence and zest for life. You can reclaim that freedom too. Your transformation can start tomorrow morning with just 5 minutes of your day. If you believe you can regain your mobility and want more information on health and well-being in later life, subscribe to the channel. Share this video with someone who could also benefit from this discovery. In the comments below, tell us about your results after trying the technique. Your independence and quality of life are far too precious to give up. Give yourself the chance to regain the mobility you thought you'd lost forever.